The Lagos State government has warned of a possible third wave of the coronavirus pandemic in the state. In a statement, the governor, Babajide Sanwo-Olu, reeled out statistics of the increasing number of cases and the need to buckle up, especially as the Islamic religious festival of Eid al-Adha nears. According to the governor, the number of confirmed cases, which had earlier reduced to 1% average as of the end of June, has suddenly increased to 6.6% rate as of Thursday, July 8. Mr. Sanwo-Olu is urging full compliance with all the protocols imposed in the country as he threatens to prosecute anyone found to have willfully flouted the protocols, particularly the travelers. Now, as at today, Lagos State had recorded a total of 60,366 confirmed cases of Covid-19. Of this number, 58,515 have recovered in community and over 1,000 are currently being managed actively in community as well. Over the course of managing the pandemic, the Lagos State government stated that about 4,382 patients have been admitted into various Covid-19 care facilities in Lagos, and it has registered over 400 fatalities. So far, the state reports that over 500,000 samples have been tested in the state since the pandemic started. And today, the state can boast of 30 accredited testing centers. That is 26 private and 4 public health laboratories in the state. Well, to talk more about the threat of the third wave in Lagos, joining us is a public health physician, Dr. Shalom Oni. Glad you could join us on the program.
I'm excited to be here, Millicent. Thank you very much.
All right. Now, looking at the increase in cases, which we saw from Monday up till Friday, even though yesterday it appears we just had very few cases, but then there seemed to be a steep increase, pretty much what we're seeing around the globe. Are you concerned?
Millicent, I was here 5 weeks ago, and I bluntly predicted that Nigeria is going to slide into a third wave. And for me, it's not a surprise because pandemic management is scientific. You can predict where you are and predict where you are going based on the data that you are getting. And the data you are getting is a function of the measures you have put in place. For me, where our MPI went south, that was where we got it wrong. And for now, I think we are still getting it wrong.
And that's the fatigue. But on the other hand, you know that Lagos, I mean, since the beginning has been the epicenter. Looking at all of the tools, seeing as it's just, I think vaccination in Lagos has just been about 1%.
Of Lagosians.
Do we have the tools? Do we?
We are in an unfortunate situation. How do I mean? We are not producing the vaccine. Let me put it this way. We are begging for the vaccine, trying to see what we can get, from our neighbors, around the globe. So we are at the mercy, of these countries. If they give you vaccine, fine. If they don't, you're on your own. And the number of vaccinated individuals, we help a lot in combating a third wave. How do I mean? It has been said, the Delta strain had a rampage in India, and UK. And it has been said that the impact of Delta strain was felt majorly in individuals who have not been vaccinated. So if we can increase the number of individuals who are going to be vaccinated, then we are sure that we're on the right track, in containing the wave of the Delta strain.
Just to quickly get your thoughts, Lagos State said people shouldn't patronize non-accredited COVID-19 treatment facilities. I mean, we had this problem at the beginning of the pandemic. Is there still fear that there will be stigma, discrimination, and people won't be forthcoming if they feel they have the symptoms of COVID-19?
Well, if you want to judge by what has been ongoing from the start of COVID-19 and now, the level of stigmatization has reduced. In fact, right now, if you tell an individual that, you have COVID-19, they say, no, you're joking, you must be joking, and things like that. But before, at the onset, people try to stay away from you, So the stigmatization has reduced. Well, however, in order to ensure that people are effectively managed, properly managed, it is important you go to accredited centers. And how do I mean? There's the issue of need for oxygen cylinders. It's not all the facilities that can provide that 24/7. Then professionals, on board. Things that has to do with your vital signs monitoring. So then facilities for testing. These are things, that will be done in accredited centers, which may not be available elsewhere. So don't model up, the management for us. Go to accredited centers so that you can be properly managed and can know what we are dealing with. So I think for me, that's what the fear is. Not really that the level of stigma is still high. It has really, really come down.
All right. We'd like to thank you, Dr. Salamoni, public health physician, for joining us on the program.
So it's a pleasure to be here. Thank you.